ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಗುಡ್ ಮಾರ್ನಿಂಗ್ ಟು ಎವ್ರಿವನ್. ಇವತ್ತು ಇಲ್ಲಿ ಅಮಾಹಾ ಈ ಒಂದು ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಫೆಸಿಲಿಟಿ ಏನಿದೆ ಇದು ಇವತ್ತು ಉದ್ಘಾಟನೆ ಆಗ್ತಾ ಇರ್ತಕ್ಕಂಥದ್ದು ಭಾಳ ಸಂತೋಷದ ವಿಷಯ. ಮತ್ತು ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಮೀನಾಕ್ಷಿ ಶೇಷಾದ್ರಿ ಅವರು ಉಪಸ್ಥಿತರಿದ್ದಾರೆ ಮತ್ತು ಅವರು ಈಗ ತಾನೇ ನಮ್ಮನ್ನೆಲ್ಲರನ್ನು ಉದ್ದೇಶಿಸಿ ಮಾತನಾಡಿದ್ದಾರೆ. ಕೃಷ್ಣ ಬೈರೇಗೌಡರು ಇವತ್ತು ಬಹುಶಃ ಬೇರೆ ಬೇರೆ ಕಾರ್ಯಕ್ರಮಗಳಿರೋದ್ರಿಂದ ಅವ್ರು ಬರೋಕ್ಕಾಗಿಲ್ಲ. ಮತ್ತು ಎಲ್ಲ ಅಮಾಹಾ ಸಂಸ್ಥೆಯ ಎಲ್ಲ ಮುಖ್ಯಸ್ಥರೇ ಆ್ಯಂಡ್ ಆಫ್ ಕೋರ್ಸ್ ದ ಪರ್ಸನ್ ವಿಲ್ ಬಿ ರನ್ನಿಂಗ್ ದಿಸ್ ಡಾಕ್ಟರ್ ದಿವ್ಯಾ ಆ್ಯಂಡ್ ಹರ್ ಟೀಮ್ ಆ್ಯಂಡ್ ಆಲ್ ದ ಮೆಂಬರ್ಸ್ ಆ್ಯಂಡ್ ಸ್ಟಾಫ್ ಆ್ಯಂಡ್ doctors who will be part of her team. I want to wish you all the very best for this new venture that you're starting, and I'm sure that it will be able to provide a lot of good service to many people who really need it the most. Mental health definitely is becoming a priority area for government and in the public and private space, and we see the impact of mental health on so many people, right from children to adolescents, adults and old age people, and various aspects of mental health are there. So many issues are now that are being researched and are being found out and well documented, whether it is concerning simple issues like or basic issues like being depressed or being having personality disorders, and also things like OCD and ADHD, and of course leading up to schizophrenia and more complicated illnesses, mental health illnesses. All are becoming part of the discourse of in wherever you go today, whether it's in the corporate sector, whether it is in schools, whether it is in governments. Everywhere these issues are cropping up, and there is a need because of the way society is changing. I think the evolution of society is also contributing to the increase in mental health issues. The access to information and peer pressure and competitive spirit and trying to the pressure to excel, the pressure to do well is also contributing, and addictions, various forms of addictions, whether it is drugs or whether it is even digital addiction is becoming a huge issue. And in fact Supreme Court recently they came out with an order saying that all schools should have a space for children to be counseled, and they should have some facility where they can look at the children, observe the children and see if they are if there are some issues with them and try to address that, and they're mandating it for all schools. So you can see the impact that it's having right from young children, because of so much of information flow that's happening, and so many things have got connected. The stress levels have gone up, sleep deprivation has gone up, and all these things are contributing to the impact on our brain functioning and impact on our mental health. So it is definitely a serious issue, and we have to address it across all sectors, and specialized care is also needed. I think this Amaha Center will be able to give specialized care where for extreme cases where in-house patients need to stay and they're monitored and they're taken care of, and find a way out for them, because solutions are not easy. It is all a very it's not as simple as treating maybe a heart attack or a cardiac arrest where you can have a fixed solution. Here it is the human emotion, and there's a lot of in-depth analysis, and of course proper use of medication, proper use of drugs. Things, even if it's done improperly, can also have a negative impact. So there are so many issues which are connected to this, and I think we need more expertise, we need more facilities, and just like what Meenakshi said, it is not very much affordable for many of the poorer people to be able to pay for counseling, to pay for these facilities and treatment. But of course, even in the government sector, we are looking at it seriously. We have an initiative now in all the district hospitals. We have this brain health initiative which has been tied up with NIMHANS, where we provide them, counseling. There is a psychologist, there is a speech therapist, there are people who are now in the district hospital level. Of course, it has to percolate down further. ಆ್ಯಂಡ್ ನಾವು ಗ್ರಾಮ ಮಟ್ಟಕ್ಕೆ ತಾಲೂಕು ಮಟ್ಟಕ್ಕೆ ಹೋಗಬೇಕಾದ್ರೆ ಅಷ್ಟು ಸುಲಭ ಏನಿಲ್ಲ, ಯಾಕಂದರೆ ನಮಗೆ ಆ ಟೆಕ್ನಿಕಲ್ ಪರ್ಸನ್ಲು ಅಷ್ಟು ಸುಲಭವಾಗಿ ಸಿಗೋದಿಲ್ಲ. ಬಟ್ ಒನ್ ಥಿಂಗ್ ದಟ್ ವಿ ಹವ್ ಡನ್ ಆಲ್ಸೋ, ಈಗ ಅಕ್ರಾಸ್ ದ ಸ್ಟೇಟ್ ದಟ್ ವಿ ಹವ್ ಲಾಂಚ್ಡ್, ಈಗ ಗೃಹ ಆರೋಗ್ಯ ಅಂತ ಲಾಂಚ್ ಮಾಡಿದ್ದೀವಿ. ವಿ ಹ್ಯಾವ್ ಗಾಟ್ 14 ಪ್ಯಾರಾಮೀಟರ್ಸ್ ಇನ್ ದ್ಯಾಟ್. ಅದರಲ್ಲಿ ಒಂದು ಪ್ಯಾರಾಮೀಟರ್ ಅಂತ ಹೇಳಿದ್ರೆ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್. ವಿ ಲುಕಿಂಗ್ ಅಟ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್ ಟು ಟ್ರೈ ಆ್ಯಂಡ್ ಐಡೆಂಟಿಫೈ ಈ ಮರುವಾಗುವಂಥದ್ದು, ಡಿಮೆನ್ಷಿಯಾ ಆಗುವಂಥದ್ದು, ಸ್ಟ್ರೆಸ್ ಇರುವಂಥದ್ದು, ಡಿಪ್ರೆಷನ್ ಈ ಥರ ಇರುವಂಥದ್ದು ಸ್ವಲ್ಪ ಐಡೆಂಟಿಫೈ ಮಾಡೋದಕ್ಕೆ ಟ್ರೈ ಮಾಡ್ತಾಯಿದ್ದೀವಿ. So that's become part of a protocol. How effectively it is implemented is another thing. But at least we've made it mandatory to look at these aspects when our ASHA workers and our CHOs and our our PH, what we call as PHCOs or AN auxiliary nurses, midwives, when they go around to look for these symptoms at least, and we are trying to educate our own staff to how to look for these aspects. So this is also what we are trying across our general population, and provide them some sort of counseling and treatment. So this is another thing that we are looking at. So definitely it is something that is a priority, and we need for people to be more productive. They need to be in good mental health. If you don't have good mental health, then I think our productivity drops, our efficiency drops, our way to contribute to the family and to society drops. So it is ultimately it's a good mentally health country is, I think, a country that is progressing well, and that's what we need. And I'm sure that I've seen many organizations that are coming up like this, and I wish you all the best, and I'm sure that you'll be able to provide a lot of good service, and any support that you need from us, I'm there. Of course, Meenakshi locally, she'll handle everything. She is there, and we are there. And from my department, anything is needed, please let me know. Thank you.